We're looking at another type of amputation, so to say, which is done in the lower limb, and this is what is known as hemipelvectomy, which is removal of the leg with some part of the pelvis. Okay, hemipelvectomy. See, this leg, line of incision, everything here was removed. So they removed the leg with some part of the pelvis. Okay, so see, seeing that. So let's go. So hemipelvectomy, you know, that is a radical surgical amputation. This is where the entire leg is removed, and also some part of the pelvis is removed alongside. Almost most of the times is due to maybe extensive trauma or cancers. So what are the indications? If you have a malignant tumor and this tumor is posing a risk of spreading from one place to another, you have to do this kind of large surgery for it. Then also, okay, that's basically aggressive cancers there, you know, aggressive cancers. Also severe trauma. Then okay, all those catastrophic injuries where limb salvage is impossible. There's sometimes infection, but it's rare. Maybe infections involving the hip joint or, you know, pelvis. And sometimes you have congenital issues, and you know, you just have to cut the leg just to arrange. So types, you have all those internal hemipelvectomy, then it removes part of the pelvis but preserve the leg. Have the external hemipelvectomy. This one you are removing from the leg up to the pelvis, you know. So surgical procedure is first the femur is removed, hip joint is removed, part of the pelvis is removed. So careful dissection is followed. Okay, and you manage the blood vessels and nerves carefully. They can also reconstruct, which is focusing on a stable trunk and closure of the soft tissues that have been, you know, severed. So rehabilitation, they can put you prosthesis, that's a man-made leg, you know, and the prostheses are indeed complex, just like the surgery is also complex. So walking requires significant energy and training. And also physical therapy focuses on trunk stability, balance, and mobility. Occupational therapy, they kind of like train this person to all over again learn how to use the leg. Then also psychological support, where you talk the person through the situation.